Thanks, Jenna. So how many of you know someone who has or has had cancer before in their lives? Okay, well in my case, I watched my dad battle cancer the past 18 years of my life, with leukemia definitely being by far the worst. According to cancer.gov, in 2013, 48,610 people are expected to be diagnosed with leukemia in the U.S., with the following 23,720 expected deaths. So what exactly is leukemia? Well, when you're healthy, the white blood cells in your body fight infection, the red blood cells carry oxygen to different parts of your body, and the platelets help blood clots. When you have cancer, leukemia is the cancer of blood cells. So it starts off in your bone marrow where the white blood cells are made, and the bone marrow begins to produce abnormal white blood cells called leukemia cells. These cells do not do the normal work of white blood cells, and they grow much more rapidly without stopping. For example, a normal white blood cell count is somewhere between 4 and 11,000, while my dad, for example, somebody with leukemia, had over 42,000. So today I'm going to talk about the main types of leukemia, the symptoms of diagnosis, and the treatment methods. First, the 4 main types. First is acute myelogenous, which is the most common of the 4, followed by acute lymphocytic, which is the least common, and then chronic lymphocytic and chronic myelogenous, which is what my dad had. Acute just means that the disease spreads much more rapidly and the white blood cells increase much faster, while chronic means that the disease gets worse much slower and the symptoms can take years to occur. At first, the abnormal cells can even carry out the normal functions in your body. Myelogenous, also known as myeloid, affects the white blood cells called myelocytes in your body, while lymphocytic, also known as lymphoblastic, affects the white blood cells called lymphocytes, which normally fight infection in your body. One last subtype of lymphocytic leukemia is the hairy cell leukemia, and that's just called that name because the cells have a hairy look under a microscope. Next is the symptoms of diagnosis. According to WebMD.com, some symptoms that can occur if you might have leukemia are things like fever, night sweats, headache, bruising or bleeding easily, bone or joint pain, swollen or painful belly from an enlarged spleen, infections easily, tired or weak feeling, losing weight and not feeling hungry, swollen lymph nodes in armpits or neck, gums with purple patches or even red spots underneath your skin. In some cases, if your brain's affected, you could also have additional symptoms like vomiting, confusion, muscle loss of muscle control, seizures, affected digestive tract, kidneys, lungs, or even heart. If you experience any of these symptoms, you should consult your doctor immediately. According to cancer.gov, the doctor could diagnose you with leukemia through things like a physical exam, blood tests, or even a bone marrow biopsy. Next, treatment methods. The first method of treatment is chemotherapy. This uses powerful drugs to kill the bad abnormal cells in your body. It targets the cells and interrupts their critical cell cycle to kill them. In this process, normal cells can also be affected. This method is given through pills, IV, catheter, or the cerebral spinal fluid, and a lot of doctors use a mixture of these methods. Next is the stem cell transplant. This method uses stem cells to treat malignancy and repair the bone marrow. It's done much earlier in the stages of leukemia. You must find a matching donor for this method, and usually the sibling is your best bet. But according to cityofhope.org, 45% of their transplants are actually from an unrelated donor. In this method, you can also use your own stem cells, and that's called an autologous transplant. One big thing that you have to worry about for a complication with this method is called graft versus host disease, also known as GVH, and that's when the newly transplanted cells attack the body, which my dad has had, and it comes in acute or chronic, and he has a chronic version of it, which lasts a lot longer. Next method is radiation. This uses high-dose X-rays to destroy the cells in your body. It shrinks the swollen lymph nodes or enlarged spleen. The technology used in this method is the spiral CT scanning or intensity modulated radiation. These methods use tiny beams of radiation in intense amounts to go to specific areas of the body, such as a tumor. This method provides much less complications and damage to the normal cells. The last method is biological therapy. This uses special medicines to improve the body's natural defenses. It uses monoclonal antibodies that kill the cells in the bone marrow, and this is methods usually given through the vein. So today, in conclusion, I discussed how leukemia can be an aggressive and even fatal disease, how important early diagnosis is for survival, and how routine checkups can also help you. Now that I shared the symptoms, types, and treatments with you, I hope you expanded your knowledge and importance of the disease.